Hey folks, we are back. I'm your host BKP. Now wait a minute. You're going to give us the rain update. I see the rain. Something told me you may give us a rain update or where we're at on the water table. Anyhow, I'm your host BKP. It is time for Ask the Doc with I got a good one here with Dr. Raymond Tidman and the multi-talented. That's it.
Yeah,
that's it. Multi-talented
Georgia cancer specialist.
No, not them yet.
Okay.
Not them.
All right. I got a lot of
weather, rain. Dr. William Willie. Thank you, Georgia cancer specialist affiliated with Northside Hospital, Dr. Willie. How are you?
My opening comments, really. People want to know why we're not Sycamore Crossing. You just look out the window out there. It's 100% chance.
I'm glad you said that because we're only a couple weeks from nice weather and being outdoors.
It was beautiful yesterday.
Yes.
All right, so now we're above We're above now. We're down an inch below in the rain, and it had me drove crazy. We're half an inch over in the rain now. But one more thing I'll say about our hosts here at the Circuit World. You saw when I walked in today, seasonal goods here.
Lawnmower.
Now you go to the store, Walmart. It says seasonal special. That's the first big fancy lawnmower with the blower and the stuff I've ever seen in here.
Ready to go.
Ready to go. All right. So that's.
Well, we're in Georgia, so one day you have a freeze warning, and the next day you wake up, it's time to cut grass. So, hi, how are you?
Present unaccounted for.
Yeah, and I'm going to New York, I told you, tomorrow to go to a hockey game Sunday.
Yes, because Madison Square Garden is 12%. They're opening up 12%.
40 degrees up there and cold. And it was 72 yesterday when I got home and sat on my porch. So you got a really bad one to see your grandkids.
But you know what? I'm looking at you thinking, hey, how can I stow away? Because you're going to a Rangers game.
Yeah.
And I tell you, in the car.
I'm going to see my grandkids.
We first have to make sure a vaccinated man doesn't have COVID.
I had to go to his office to get a test yesterday. I have to have a negative test to get in Madison Square Garden, and I've been vaccinated.
Okay, wait a minute. So you're going, now you're a doctor, you've been vaccinated. Yeah. Okay, but you're flying to New York.
Tomorrow morning.
And the rules are they have 12%. Madison Square Garden's open, but if you go in the garden, you have to prove a negative test
within 72 hours.
So you had to go see him yesterday.
Yeah, I did.
And he's vaccinated.
He's vaccinated.
And the percentage of the success of the vaccine is higher than the percentage of the testing. So. Figure that.
How much that make any sense?
What are the odds in Vegas on here? If you're getting Vegas odds on Whaley at the Garden,
I didn't have to take off my clothes to get the test.
Yeah.
And the other thing was,
let's not let this go the wrong way.
Jane said they're going to stick this big thing down your nose. I said, Jane, they just took a little cotton swab and rubbed my throat. So I'm going to tell you, getting the test is nothing like they used to say early on.
It's not the brain biopsy anymore.
It's not the brain biopsy.
But it's not the rectal biopsy either.
All right.
So.
Okay.
That was the Chinese.
So I'm excited to say,
it was just a joke.
For those out there, I'm a hockey lover. I know what it's like to go to see the Rangers at the Garden. 12% capacity.
It ain't gonna be the same.
Exactly, but good for you. All
right, let's get on. We got to get on here now because we're here to answer questions, and this is a really good question, and it's got a lot of educational value for patients about what really modern cancer therapy is all about. Listen to this. My wife had breast cancer surgery at a Northside hospital. Now, we have a huge number of Northside hospitals. She's going to show a map in a minute. 2 weeks ago, yesterday, we met with a medical oncologist who went over the pathology and lymph nodes and things with us, and she said she had, quote, unusual features, end quote, and wants us to wait 10 days for follow-up before he presents her case to the Multimodality Tumor Conference. What is that about? Should we be worried? Now, so here it is. The guy's got the data. He's got the lymph nodes. He's got everything else. And 90% of the time, 95% of the time, they would immediately say, no negative, no positive. You should do this, you should do that, do something else. And he said, let's wait. There's something unusual about it. So show that first thing there. Common things are common, right? And so when you hear hoofs, you're supposed to think of horses and not zebras. But this thing that you've got up there on the board now is a list of about 10 types of breast cancer. And some of these, that one right there, second from the bottom, in my practice now 50 years, I've seen 2. So, and some of these, you can pull it down now. But I don't know what the unusual features of this breast cancer was, but I do know that there are cancers that are extremely small in the percentage of breast cancers. I said last week that breast cancer is now the #1 cancer in the country since lung cancer has gone down, right? So there's lots and lots of breast cancers. This is relatively small. Throw up that next one. So 2 or 3 things could be going on here. This is just a flow sheet of 1/8 of the clinical trials that are available in the Northside Cancer Center, and these are the same clinical trials you'd get if you were at Sloan Kettering, for various types of breast cancer that might be the driver that has him looking at going for some help. Okay, take that one down. And then the other one might be, this the hereditary one you got up there? Yeah, okay. So it could be that there are genetic markers and hereditary things that have got him sort of worried here. Still there? Mm-hmm. All right, pull that one down and we'll talk for just a minute. So we see a lot of breast cancer. It's obviously the most common cancer that I see, but I also see a lot of lung cancer and lymphoma and prostate cancer. In the Northside Cancer Center, there are about 160 medical oncologists like me. Spread. Show that map. There's a map right there of the state of Georgia. You got out there where you got a good look at it. If you look at this map, and you can't see it on your screen here, but there's little white dots everywhere, and every one of those spots represents a independent. The 2 at the top, by the way, see those 2 at the top? That's ours in Blue Ridge, and that's the Blairsville office of Georgia Cancer. Okay, pull that down. So let's just assume that that patient was operated on at Northside Cherokee, but lives in Cumming or somewhere and is going to one of the Northside Cancer Centers, has a doctor like me, has unusual features in this tumor. This multimodality tumor conference they're talking about, we've got specialists in the 100 and so medical oncologists who focus their attention on one particular cancer, although they treat others. So they're the experts among the experts. Do you understand what I mean?
Yes.
Yeah, I think I've used this analogy before. Back when West Paces Ferry Hospital was there, they built the first specialty hospital in the South for just eyes, and it was called Metro Eye and Ear Hospital. And all the big specialists in the state moved to Atlanta then. And I used to say, we have doctors at that hospital that operate on the cornea, some on the iris, some on the water, some on the retina, and some don't even operate on the eye itself, just around the eye. Well, so what this conference is going to do, by video, so that the doctor doesn't have to leave his office, they're going to have breast radiation therapists that do nothing but breast radiation therapy. They're going to have geneticists. They're going to have medical oncologists who specialize in chemo or specialize in other things. And they're all going to discuss your wife's case. And they're going to say, we think that the best thing to do for her is this, for this reason, or she's ideal for a certain clinical trial. So I don't think you could get any better up-to-date care than she's getting, and the fact that she's going to be presented to that multimodality tumor conference means that all the experts that are available in every part of breast cancer treatment, including plastic surgery, will discuss your wife's case and come up with a plan, and that you should be grateful for the chance.
Obviously, it's not unusual that almost all medical, anything medical or your health, you say don't worry, but people worry.
Right.
Yeah. They worry. And in this here, although it's understandable somebody is going to worry about this, this is actually big that, you have all these professionals, experts in their fields that are going to come together, and whatever they decide, you're getting the best of the best treatment or
yeah, smarter people than I are thinking about your wife.
Right. So
and they're knocking it around and discussing it,
Right.
and maybe we'll come up with yet another idea as they do it. Bill and I are obviously very proud of our profession most of the time, except for some current disease that's going on. But in the meantime, I mean, think about the excellence that's displayed in this. I mean, this is not like, okay, we'll pay all these guys to get together in a room and discuss something. These guys, of their own free will and their own time, will say, you know, this is a tough case. Let's see what we can come up with. What area in the world does that kind of work?
For free.
For free.
Right.
Oh, and by the way, they do them at 7 in the morning so that that can't see their patients.
Right.
And the infrastructure to put this together and have people do literature reviews, you have to have the pathologist and the slides and the radiologist and everything, is huge. It's a big expense that's done for nothing, and you don't get paid for it.
And it speaks to the system of care that our country has that people like to beat on. So,
Hey, folks, don't forget you can send those questions. That itself a great question. You can send those questions to info, I-N-F-O, at FetchYourNews.com. Put Ask the Doc. Follow us on social media. Write a question there. Ask the Doc. And again, thank you, Georgia Cancer Specialist, affiliated with Northside Hospital. Well, were you done with that one, or did
I am done with that one.
I didn't know. I didn't want to interrupt that. So, you ready to go?
But you're driving the boat here, so.
All right.
You want me to read this next one?
do
Well,
I need
go
to
ahead.
get my life jacket on?
No. Yeah, outside. Okay, this is kind of interesting here. All right. My husband is 78 years old. Okay, so the guy's got some years on him. And he is finishing 6 months of chemotherapy for lung cancer that could not be removed because it was around his heart. So that tells you that it's pretty big localized tumor in there. And he was treated with what sounds like aluminum and B12 shots. Now, right off the bat, you got to think he's getting treated somewhere strange, or she just remembers how it sounded, which is good. Now they want him to take a year or 2 years of an immune drug that sounds like infinity. That's a car, right? What is your opinion? Now, I'm not joking about I really don't mean to diminish this, but I think this is pretty typical of what a doctor will hear a patient remembers when they come back to the office. We'll speak to that in a minute. Put that picture up of the lung. So this is exactly what this patient has. You see these little growths right here?
Yes, I see
There's
that.
not a way in the world anybody can cut that thing out, because you see what's sitting right there, that's his heart.
Mm-hmm.
You'd have to take the heart out to be able to get that out of there. So it ain't coming out, right? All right, take that down. Now, he was treated with B12 shots. Now, I don't think you've ever heard of any cancer that's treated with B12 shots. Aha, but it really is. Okay, show that next one right there. There's an old drug called Methotrexate. Ray's been giving it for years to people with rheumatoid arthritis, okay? It interferes with the B12 and the folic acid metabolism, so when somebody takes Methotrexate once a week for rheumatoid arthritis, they got to take B12 shots. This cancer drug is called Methotrexate. It'll be 3 or 4 years ago we discussed this drug. If you remember, we haven't talked about it in years. But this top graph there is this Methotrexate drug given with vitamin B12 and with a platinum drug, which does make a difference, for 6 months, and how the survival of that group compares to the group that's below, that's treated with the old type of chemotherapy. Well, you've been around long enough to know if the line up here is the line you want to be in, and the line down here is the line you hope you're not in, right? But to be in that line, you're going to have to get a B12 shot. And he got 6 months of it. All right, you can pull that one down. So what that tells you is that for 6 months, which is the length of this treatment, the guy's done well. And when he got to the end, he was doing so well. Pull up that next one. The next one's a picture of the Imfimzy. The drug is called Imfimzy. Well, that sounds a lot like infinity.
Close.
It's darn close, isn't it? Yeah. All right, now put up that next slide. They're going to be through this question. This slide here starts where this one ends. In other words, when you get to the end of that treatment right there, the next experiment is to either give you this drug or give you a placebo. This is the targeted therapy like Jimmy Carter got, has been on it for 3 years. So FYNTV is one of those anti-PD-1 drugs, and it doubles the survival, top line, doubles the survival after the next year or two. So you can pull that down. Your husband is getting the top care you can get. He did really well for the first 6 months because they don't go into that second section unless you're have had a good response. And now he's going to be treated with the Jimmy Carter drug, and he's getting the right treatment. So that's the end of that.
Okay. All right. I want to ask a quick question before we get into any
Not
other...
from your mother.
No.
Your mother didn't have a question this week.
Not this week.
Okay.
Well, wait a minute. If I would have asked, there would have been a question. So I didn't inquire. So
Okay.
we'll
All right. Go ahead.
Never want to say she's short of a question. But I want to go back a couple weeks because maybe a lot of viewers are wondering. I myself was not tuned in, no pun intended.
You expect me to remember 2 weeks ago?
You'll get this one. You'll get this one. I was not tuned in so much to exactly what kind is lung cancer. It's a two-part question. Is lung cancer just lung cancer, variations, and why could they not treat Rush Limbaugh? What happened there with Rush in his cancer?
Okay, Rush got really good care for a long time and responded to a drug like FYNTV.
Okay.
He reached the point where, as they treat, how long has he gone with this? 2.5 years or
yes,
something like
that? Yes, he has. It's been a battle for a while.
Yeah, but the stage he had without response has a life expectancy of 6 months. And he told us that when he started. I think he got 30 months or something close to that out of it. So he did respond to chemo. He never was a surgical candidate. So he had advanced cancer at the beginning. So he was treated with...
So when he was diagnosed, the stage...
Yeah, stage was advanced when he started. And he had a whole series of different treatments. And the last treatment, as best I understand it, was immunotherapy. And then it's like when you give antibiotics for a bladder infection where you shouldn't treat at all. This is something we talked about before. If you have an asymptomatic urinary tract infection and there's bacteria in your urine, you're not symptomatic, and you do your analysis and somebody cultures it, comes back out a germ in there, you don't treat that. You remember me telling you that the highest incidence of in-hospital deaths in one of our large hospital systems was antibiotic-resistant bacteria in women who had been treated for asymptomatic bacteriuria. So you treat those with antibiotics 2 or 3 times, and then that bacteria learns how to resist that antibiotic and becomes resistant to it. Then it goes off on its own. Well, cancer does the same thing. So if you got a big old lung of cancer like this, and you can whittle it down to something smaller than a pea, that part that's still alive that's smaller than a pea is resistant to that treatment that you gave it, and that's what happened to Rush. So you ran out of options.
All right, okay. Very important. Stage is very important.
Right.
Early screening, early screening for all cancer, and don't hesitate to get your checkups.
Right, well, this one right here is stage 3 by definition. 4 means it would be metastatic somewhere else. Unresectable is stage 3, probably stage 3B. And so there's lots of stages that are downstream from that you could remove, but not this one. And that's the way Rush was.
Okay. Well, what do we want to talk about now?
Well, we've got all sorts of stuff to talk about.
Do we? What's top in the news?
Well, Ray mentioned it a little while ago.
No, you see, the thing is, I'm going to give up the secret. Okay.
What's the sauce? You're going to give the sauce?
Giving the secret up. Folks, these two emailed throughout the week. You do. Yeah. They email throughout the week, so they have a pre-conversation.
But I only include you. Well, no, you think you don't have how long I work on this? You got
yes, I do.
You do because
I get the copies of the emails.
These copies. So does Emily. So here it is, right there. What's the top line?
What happened to flu season? Dun dun dun.
I'm going to shut up because before we went on the air, we were discussing this. And Ray has an idea about what happened to the flu season. Because as I said a couple of weeks ago, the early data from the CDC, and this was in December, January, was that the flu season is just cranking up. and you need to get your flu shot because we don't know how bad it's going to be. Well, now we're 8 weeks later, and what's the story, right?
Okay, you have the floor. Before you go, number one thing people say to me, not in conversation, but when we're talking about COVID or something, where'd the flu go? And that is...
Well, I mean, I'm speculating here, but I think it's a reasonably informed speculation. Let me give you an analogy. When we learned how to take blood pressures with a little cuff and stuff, we had an epidemic of hypertension. Well, it wasn't that hypertension was going crazy or that it was a new disease. It was a new way of diagnosing something.
Sure, PSA and a mammogram.
Same thing with prostate cancer, mammograms, all those things. So when you start looking for something, you find it. We've not been looking for the flu. We've all been told to go home, don't get out, and all these secondary things Bill and I keep talking about, not seeing your doctor, not getting screened, all these kind of things. Well, the cancer's not gone away. It's just going to be later staged and worse next year when they do start looking for it again. The flu's still out there. People are not coming to the doctor's office with flu symptoms getting tested for the flu. So that's one simple answer. The second possible answer is that you've got another, quote, disease going on that people are looking at and paying attention to, and they're ignoring the flu symptoms. So that virus is not likely to have gone away or be any different this year than last year, but it's most likely that what we're paying attention to is not the flu.
Yeah, and I think another one is that you're not putting your hand on the escalator where 10,000 people have been before you coming off an airplane. When you go into the Ingalls, you're washing your hands and you're wearing a mask and you're staying 6 feet away from people. Well, that's going to diminish.
Hand washing alone,
right.
and good.
Because
the flu is transmitted on doorknobs and stuff, unlike COVID's in the air. And then the final piece is the flu is, we know, much more deadly to the younger people than the older. So it's a worrisome thing.
And the kids aren't in school, so they're not getting it.
Well, you're putting a lot. The kids aren't in. Well, usually, what takes place is the first week of school. All the kids come back, and they all get together, and they bring everybody home a cold. So a severe cold, head cold or whatever, starts making its rounds 2.5 weeks after school opens, where the kids all get back together and they're sniffling and everything, and next thing you know, a cold outbreak. So basically things like not having school may be...
Well, I mean, let me jump on that.
You see what I'm saying? Okay.
Oh, yeah, absolutely. But I'm going to stay apolitical here, but this year, I think there have been, or 2020, there were 1.5 million deaths from tuberculosis in the world. 1.5. Okay. We don't talk about TB. We don't shut the country down for TB. We don't have everybody start wearing different things for TB. We don't tell people not to see their doctor because TB's out there. 1.5 million cases of tuberculosis. What is it? 2 million for COVID deaths last year?
Right.
Okay. Not that far a difference, and yet COVID, we've shut the world down. We've altered everything. All the systems that we've developed to try to deal with and surveil and treat diseases have been knocked on their head for this one condition. But there are other conditions out there. I mean, there are a lot more people die from heart disease every year than COVID. A lot more people die from cancers than COVID. This one disease has upended our economies. It has changed how we seek and take care of health care, all because a few people in a few places had a lot of power and they scared everyone. I'm not assigning a party to this. It's just wrong-headed. It has been wrong-headed, and it needs to end soon. So in this little conversation you and I just had, I don't want anybody to think, well, we should stop having schools. But that is an interesting point. Well, the teachers have a double lose here, okay? What if grades were going up and suicides were going down and they were staying at home and not teaching? That'd be the end of in-class teaching, wouldn't it?
Yeah, it would.
But it's the opposite going on. They're staying home. The kids are killing themselves.
Wait a minute. No, I want to back up. I want to put that brake sound on, screech the brakes, and back up. So if grades were going up, suicide was going down, And what else? How did you buy?
Well, and
we have the recording.
And the teachers were all staying home.
Then that would be.
We don't need teachers in schools.
Persons.
Yeah.
So, then you wouldn't need teachers anymore. You hit on something kind of interesting that historically, up until 2 years ago, when kids go to school, they bring coals home to their parents.
Right.
There's only two people here, me better than Ray, at age that when I was a boy and when I entered medical school in 1960. You have never even heard of acute rheumatic fever, but strep throat, streptococcal disease, has an allergic reaction or an autoimmune reaction that affects your heart. It was most common in women of childbearing years and school teachers, because in the fall of the year, kids would go back into school, get strep throat, the teacher would get it, and the teacher would get rheumatic fever.
And have injuries to her heart.
And have injury to her heart that would kill her over time or have to have heart surgery. So in those days, there was the epidemics that occurred that were kids brought it to the teachers. Now, after you got rid of rheumatic fever, it became viral and kids brought the colds home to their mamas. But still, the concept's the same.
I'm not quite that young. My mother died when I was an intern of complications of rheumatic heart disease.
Okay, well there you go.
So, and Bill's exactly right. The kids move that around, but that's how we evolve as a culture, and particularly in medicine, is that we find the disease, we figure out how to diagnose it, we figure out how to treat it, and we figure out how not to spread it. We don't throw everything away and say, let's all go run, hide, and the sky's falling, and then we don't do it for a year. And then we don't keep doing it because somebody thinks, well, this which hasn't worked will work someday if we keep pounding on this hammer.
Well, I don't want to get your hair on fire.
Right, because I don't have a lot of it.
But I had to throw that. Sorry. Don't want you to get your hair all on fire. But I watched several committee hearings, from committee hearings in Washington, D.C. to committee hearings in Atlanta. And I watched several this week, several hours of the double mask.
Oh gosh!
I say I knew. Sorry.
Well, hey,
sorry.
Right, I've got another.
But I know
there's another visual.
I'm sorry. They were. You know what I'm saying?
Yeah.
But we have somebody going on TV that is supposed to be in an authority in the medical world saying, yes, a double mask would help.
He's an authority, as the tumor board might be, in a particular niche, in a particular area, and you'd love to have him in a room with people discussing things and get his idea. You don't want to give him control of the world. You don't want to give anybody control of the world. Here's a great another visual for you, okay? What do people complain about with the mask when they go outside? Certain masks. My glasses fog up.
Yes,
right?
I understand.
Doesn't that drive you crazy when your glasses fog out?
Yes.
Well, what is that telling you is going on with the air coming out of that mask? It's not going through it, it's going around it. Now, if the air is not even going through the pore filter to start with, and it's just going around it, it's nothing more than a face shield. And that doesn't stop the spread of COVID. I mean, if somebody spits or sneezes in your face, the face shield stops the spread of COVID. But the mask, just by the aerodynamics of it, is pushing air out because it's wet inside and the air can't go through it, and it's fogging up your glasses. So there you have, when he said, common sense tells you that if one mask is good, two is better, I'm like, no, common sense says the opposite of that. Because now you're totally blocking air from going through here, and it does have to go around it, and how in the world can that help?
Now, if you got an N95 mask, appropriately fitted.
Right.
And the one thing is, everybody wearing an N95 mask isn't got it appropriately fitted. Right. And then it's gonna do 95%. It's gonna do 95% work just like it's supposed to do. And the people that know how to wear that, you know what occupation they're in? Construction. They're working.
No, I agree with that.
They're working around
and nasty
grounds and nasty stuff.
And when they take that mask off, you can see a clean face and nasty face.
And they've got a big line where it's been fit. Right. But I have patients.
We ran a lot of, years ago, we ran a lot of routers that had fine powder because in construction for years. So we ran we ran routers that when we cut and did things, we had a lot of fine powder in the air. So we always had the N95s, N or M? N. Now we had the N95 mask in the truck at all times. They went in with us as part, and at the end of the day, it's really funny, and I'm gonna throw my brother out there. He pull it up, and have it on his head. He'd come in and it's on his head so he can go like this, and he would have a white ring right here, right. Just like you're saying, but they worked very well because we worked in a lot of dust.
In those years I was in the aviation consulting business, the people that are extremely well trained in industrial schools, that's why I love, as you know, I love these community colleges that teach people mechanics and HVAC and all that stuff, but not anybody working in a commercial airline working on engines or anything like that hadn't got a high degree of expertise and a high degree of experience and makes a real good living. You didn't have to get an English degree from somewhere and not be able to find a job. But anyway, if you went in that paint shop and into the place where they fix the engines, everybody's wearing an N95 mask, and the OSHA requirements were so great, but people followed them. People were well trained, like in the military. If you do exactly what you're supposed to do when you have figured out the right protocol and then people adhere to it, they didn't have a whole bunch of industrial lung disease. I think people got enough of it when they're working in the copper mines and stuff, and they learned that you can't go and do this sort of work and just breathe the air; it'll kill you. Well, that's where the N95 mask came from. So
and by the way, as you say, there were OSHA studies, there were discussions, there was back and forth to say, is this intervention worth
this data
the effort? Yeah. So that people would buy into it.
Right, but then what happens is you take that science and then you let everybody in the world buy a mask and wear it like this or something. Yeah. It doesn't make any sense. These things are fitted. I mean, and they came in different sizes. Oh, and you can't wear facial hair. Because if you can't wear facial hair like this because it wouldn't seal right. So, I mean, you've got to do some stuff. You got guys with beards you see walking around with a mask on their face. That's the dumbest thing in the world.
Well, I had a patient I got the image of it yesterday with a beard, with the mask over the beard and the nose hanging out. And the excuse it was a valid excuse. He's a lung patient, COPD, or can't breathe with the mask on. He ain't doing it. I mean, the mask is nothing but a showpiece.
Yeah, that's right. He's wearing a chin strap.
Strap.
I got one more I want to put into a box for conversation. Got my panel ready to go, but I want one more now. Our immune system, and let me go with this because, I grew up playing in the dirt. Okay,
I hope so.
Had a Tonka truck. I know for those out there,
I made a few mud pies.
Not catching. Had a Tonka truck. Grew up playing in the dirt. So.
Including Mumbly Peg.
And Mom said, "Don't eat that dirt." So that was part of it. So anyhow, no, we've seen things change. Okay.
My mother said you have to eat a pint of dirt before you're 12, or you won't be immune. Yeah. That was way early. But they've shown that if you don't crawl around on the floor and eat dirt and have puppy dogs and play outside, you don't get as good an immunity.
I have one of the best son-in-laws in the world, and when the young grandson falls down and skins his knee, his dad says, "Throw a little dirt on that and get up and play."
All right, go on.
Okay, I like that. So our immune system. So let's back up a year. We interacted with people, went into stores, went into crowded theaters, went into crowded restaurants with somebody pushing at your seat behind you, all the above. And then we went to zero tolerance of everything in the world. Okay, germs. I keep my hand. Now I always did, but I keep my hand sanitizer. I make sure my buggy has a nice bath before I push it through the grocery store. All that. Now we're opening at percentage capacities. In dining restaurants down Georgia, it's been for a while, but in dining in New York, New Jersey, Pennsylvania, 30% now.
Goofy numbers.
Yeah. You're going to a hockey game, 30%. I went to a football game last night. The state of North Carolina said that they could have 30% occupancy. But I'm watching, and
It's outdoors.
where are we at? What's your concern with our immune system? When you hear, and I guess I'll put this all together, you can cover every piece I just put together, but when you hear we should be back to normal X, what is everything like that and starting to gradually open? What do you think?
Well, let me answer it a little bit differently than you questioned it, but I'll get to your
Okay.
real quick. Early on, I think Bill and I came to the conclusion in this test, that in this disease, that we needed to protect the fine china,
Yes.
and we needed to identify people quickly and get them treated best we could. Okay. That's been the case all along, and now it's absolutely the case. Okay, that everyone needs to get back to their life, and everyone needs to get to understand their risk and get protected as best they can. That has not changed. I predict in a year from now, we will see the tons of health problems that have been pushed back, which are going to now be worse in 2022 because of 2020's treatment. Okay, I'll throw that prediction out there. I don't know how much money I'd put on it, but I'm pretty damn sure it's going to happen. And then the historians will start looking back at this thing and say, well, how in the world did we do that? How in the world did we come up with this idea that life does not have risk, and that you can mitigate all risk in life, and if you just do what the professionals and the godly people with the white jackets on or coats or whatever say, then you'll be okay. Life has risk. We're surrounded by it every day. Bill and I are going to go back up to the office. It's about, a quarter of a mile? We still could get killed in the car on the way up there. And we mitigate those risks, and we try to minimize them, but they are out there. So there is no one thing that should ever overwhelm you, and we should go back to mocking the germphobes on TV. You know, the characters that are, wiping and cleaning everything and they won't touch anything and that are scared of folks. I mean, that's an extreme case of human life, and they're kind of funny, and we need to let them be funny.
And you?
Well, when you say back to normal, I do not believe that the crowded elevator, the crowded subway car is going to occur again, because we've learned that these big offices don't need to be full of people all the time, and our daughters that are in banking plan to do 80% or 75% of their work from home forever. And the commercial real estate people are changing the way that the offices are constructed, such that the office will be occupied every day, but it's only going to have like 20 or 25% of the people there every day. They're going to be at home.
And HVAC systems will have ultraviolet systems in them.
So that's all going to be changed. Now, I think that I hope that you'll be able to go to Madison Square Garden and have it absolutely full, and listen to Billy Joel or watch the Rangers or the Knicks and somebody play basketball. I really hope that we will have sporting events and we'll be able to go to concerts and stuff and have all the seats full and be fighting, paying for tickets and standing outside.
And wrestlers getting up and shaking each other's hands.
Yes, my grandson, I told you, in a state wrestling
What do they call it?
tournament.
Waller? They waller around on the mat, all sweaty, and then when they get up, they can't shake hands.
I mean, that was my grandson. This is a true story. I mean, that's the truth. So I'm not positive that in the business part that things are going to get back to like they were before, but I sincerely hope that social events, sporting events, concerts and stuff come back, and that the guy can be in a full stadium.
I will say this. I do think there's some things we've learned. All right, there's some takeaways. When you do anything, like anything I do, we have meetings or whatever, okay, when we wrap up, what are the takeaways? What are the takeaways? So I do think there are, but there's some things where there's not a takeaway, and we went backwards. Because like last night, the reality is I was over in North Carolina. They're playing high school football now. Well, that's okay. They're playing it now. But I watched these guys because I was down on the field and I did a post-game interview with the coach. So I'm down on the field and he's having a talk with the guys, and the guys are sweaty and
the weather's nice.
And they're all sweaty and everything like that. But when they got done playing, the two teams had to wave to each other. The rule, they could not do well, they couldn't go through the line.
Like
you use
but
the
you
word,
understand
you use
they
the
have
word backwards, and so let's throw out there. How do you know when you're going backwards?
Yeah,
When you start depriving people of their freedom. Okay, when you start depriving people of their freedom, you're going backwards in life. The Nuremberg trials came out after all the horrendous stuff in Germany and such. One of the things that came out of those trials is that you're not allowed to force humans to have something done to them that they don't want to have done. Okay, that includes sticking a probe up their nose and twirling it around. Right?
So now they're sticking a little thing down your throat.
Okay, I got full panel over here.
All right, that's good.
I've enjoyed the count. You got a closer?
Now I wish I did.
Now we ran overtime.
Nobody has a closer? No.
Donate blood.
So
Get the bobcats off your porch.
And donate blood.
So just like you said, I have been so irritated because I go in the grocery store, I have to wear my mask, and I do, but then I have to wear my glasses like this,
And then you can't see the stuff.
Well, no, it defeats the purpose of my glasses in the grocery store. You know what my purpose is so when I turn the aisle, I can see clear to the other end. If I'm all fogged up, I can't. Or two, if I have them up here, I can't see to the other end. And what if there's someone down the aisle that I would just prefer to just say,
not to talk to.
It's messed me all up.
Yeah, that's.
And actually, the case is, I usually see somebody I think doesn't want to say hello to me, so I don't want to put them in them. It's just a joke. It's just a joke.
It's another life hazard.
It's just a joke. But the fogged up, you're so right. I'm wearing my glasses up here in a mask.
Get your eye surgery where I got mine. You won't need those glasses anymore.
One of these days. Thank you, Georgia Cancer Specialist affiliated with Northside Hospital. We appreciate you so much for this segment. Thank our viewers out there. If you ever want to send Dr. Whaley a question, you can send that to info at FetchYourNews.com, or find us on social media. It's not hard. Fetch Your News on social media. Send the doctor a question. Also, these great segments, if you want to share with your family and friends, FYNTV.com. Ask the doc. They're right there. You can share all of them. And our YouTube channel, FYNTV Fetch Your News playlist. The playlist is Ask the Doc. So share these with your family and friends. Great information from these two great doctors. And again, Georgia Cancer Specialist affiliated with Northside Hospital. Thank you. We have over in the green room. We officially have a green room.
Yeah.
Yeah. They have
Great couch.
They have pastries over there. They've got coffee
Check it
and
out.
creamers.
Face makeup.
Yes, everything. We got hair, makeup, everything.
Makeup,
Yeah, they're powdering Rick's nose right now. Oh, no, I'll get in trouble. Right after these messages, All-Star Political Panel.